Hemostasis is the process in which our bodies form blood clots in the walls of damaged blood vessels. This process is important for preventing large amounts of blood loss and for maintaining blood composition within the cardiovascular system. The first step in the hemostasis process is the vascular phase. A damaged blood vessel responds to injury by vasoconstricting, which reduces the amount of blood flow through the site of injury. This vasoconstriction occurs in response to factors that result from a damaged blood vessel. Among these factors are signaling molecules that are released by harmed endothelial cells and activated platelets, along with nervous system reflex from pain and direct injury to smooth muscle. As an injured vessel vasoconstricts, the vessel wall undergoes intense contractions that narrow the wound opening. This phenomenon is known as a vascular spasm, which reduces the amount of blood lost.
The next phase is the platelet phase, and in the platelet phase there are platelets, which are signaled by these green cells right here that are in constant circulation with the blood, but they are unlike other cells because they are fragments and they are unable to divide. Although they can't do some things, platelets are essential in healing. Platelets have enzymes that promote blood clotting, such as ADP, which stimulates platelet aggregation, thromboxane A2, which stimulates vascular spasms, and serotonin, and clotting factors. When a platelet is floating down a compromised vessel, they are strongly attracted to the injury and they stick to it, which is shown by the platelets coming and making that right there. Then they swell and they attach to their neighbors. The platelets then become very sticky and act as a plug, which will be reinforced later on.
The third phase of hemostasis is the coagulation phase, also known as blood clotting. It involves a complex sequence of steps leading to the conversion of circulating fibrinogen, a soluble protein, into fibrin, an insoluble protein. As fibrin network grows, blood cells and additional platelets are trapped in the fibrous tangle, forming a blood clot that seals off the damaged protein of the vessel. It does not start until 30 seconds or more after the vessel has been damaged. Normal blood clotting depends on the presence of clotting factors, or procoagulants, in the plasma. Important clotting factors include calcium and 11 different other proteins shown here in table 19.4. Many clotting proteins are proenzymes or inactive enzymes, and they are converted to active enzymes where these proteins direct essential reactions in the clotting process. The coagulation process involves chain reactions of extrinsic pathway, the intrinsic pathway, and the common pathway. The extrinsic pathway begins when damaged endothelial cells or peripheral tissues release factor 3. The tissue damage goes up to factor 3, where a greater damage or more tissue factors is released and faster clotting takes place. Factor 3 then combines with calcium and another clotting factor, factor number 6, to form an enzyme complex capable of activating factor X in the common pathway, which was the first step in the common pathway. The intrinsic pathway begins with activations of proenzymes, which are usually factors 12, exposed to collagen fibers at the injury site. Activated factors 7 and 9 combine to form an enzyme complex capable of activating factor X activator complex, which activates the common pathway. Now, as you can see here, the platelet factors and the factors that I mentioned before and calcium all come together to activate this complex into factor X of the common pathway. The common pathway begins with enzyme complex. Form either pathway activates factor X on both sides, as we mentioned before. Factor X then activates a complex called prothrombin, which then activates, which converts the proenzyme thrombin into the enzyme thrombin. The thrombin completes the clotting process by converting fibrinogen, a soluble plasma protein, to insoluble strands of fibrin, producing the blood clot, as shown right there.
Once a blood clot is formed, the healing process has begun. From here, inflammation at the site of injury draws in leukocytes to eliminate pathogens. Once a blood clot has formed, the healing process has begun. From here, inflammation at the site of injury draws in leukocytes to eliminate pathogens. Then, the clot retracts as tissue heals. Clot retraction is a process in which the size of the blood clot reduces over time. As this occurs, the edges of the injured endothelium are slowly brought together and replace the damaged endothelium. The final step of hemostasis is called fibrinolysis. This is the process in which a clot gradually dissolves. It begins when the proenzyme plasminogen is activated. When plasminogen is activated, the enzyme plasmin is produced, which then digests the fibrin strands of the clot, which we recognize as a scab. Hemostasis terminates when plasmin has eaten away at all of the fibrin strands and only healthy new cells remain.